Okay, hello everyone. My name is Kevin Johnson. I'm the founder and chief operations leader at Kano and Associates. I will be your moderator for today's webinar. It will be recorded and it will be made available for on demand after this call. First, I want to welcome everybody to summer. It's going to be a good time of year for everybody to spend time with their friends and families. And I want folks to pause for a second and realize there are so many frontline healthcare workers that have very stressful jobs, and we need to be thinking about those working conditions and the need for them to be able to generate less stress and get away from home and spend time outdoors this summer. We are in the middle of the most rapidly changing technologies and tools transformation in my long career. It is meeting up with frontline workers and other users who demand better technology and tools. Our next presenter will educate everybody on that. But before I pass the baton to her, let me say that operations management of the frontline workers needs a prominent seat at the stakeholders table in any healthcare system or practice. Simply ask ChatGPT, which is the best financial model for employee experience and patient experience. And the answer will be total economic impact, not traditional ROI models. I will discuss that at the end of the session a little bit more. But let me now introduce today's agenda of experts. We have representing Kano and Associates, Amy Hood, talking about healthcare staff experience trends. From Spinzai, we have Andres Hurtado, talking about healthcare staff-centered workflow. We have from IntelliPeer, Corbin Fields, talking about healthcare automation communications hub capabilities. And we have Level AI and Richard Schumann talking about the buzzword conversational intelligence and AI tools that will match up and help to deliver the things that the first three are going to talk about. And then I will come back and spend a few minutes at the end talking about a recap and then next steps you want to take. So with that, Amy, a person that has probably interviewed more healthcare workers as to their next opportunity or the reason that they left their previous job. So she's going to kick this off by talking about the staff workers.
Thanks, Kevin. Thanks so much. I'm always happy to talk about employee experience in healthcare, retaining talent in healthcare, because those are huge issues right now. So I thought it would be helpful to just dive into what the current landscape is. Right now, the top challenge for CEOs across the country is staffing. Certainly 70% of CEOs are concerned about attracting talent into organizations and keeping the talent they already have. In 2022, it was the year of getting more talent in the door. In 2023, it's all about employee experience and keeping the talent you already have. And it makes complete sense that CEOs and others in healthcare are so concerned because the healthcare shortage or the workers in healthcare, the shortage of workers, it's only getting worse and it will continue, certainly for the next couple of years. One thing I'm happy to see healthcare organizations take a keener interest in is the actual turnover rate, retention rate, and the cost of attrition. Up until the last few years, many C-level healthcare executives would always say, yes, people are our greatest asset. And they would say, yes, we want to keep folks in healthcare, but they really wouldn't dig into the numbers and take a true assessment of what the cost of losing those employees is. And healthcare continues to be super traditional in terms of how it employs workers. So certainly if you're a healthcare system, a hospital, you might use contingent workers to augment your regular direct hire staff. But typically you need a core group of direct hire staff so that you can continue your patient care and continuity of care for patients. So healthcare institutions, healthcare organizations, typically when you lose a direct regular hire on your staff, you backfill them with a regular direct hire on your staff. And if you don't already know this, it costs 1 to 1.5 times that departing employee's salary to backfill them. And that includes the effort to source a replacement, recruit them, onboard them, and train them up to productivity. So 1 to 1.5 times the annual salary, and that's for frontline skilled healthcare workers and clinical workers, of course. And then certainly what I hear on a day-to-day basis when I get the call from folks who are leaving healthcare or changing jobs is, it's certainly an AMA stat that's reflected, which is, I'm burnt. I've had enough. I'm either out of the profession or I'm ready to move to something else. And it certainly doesn't take into consideration the other people who are showing up in healthcare who are not burnt, but they're disengaged or otherwise dissatisfied with their work and considering leaving. So it's not all doom and gloom. I get to obviously work with healthcare organizations every day. I'm working with managers on who they want to attract, but I'm also fielding those calls from healthcare workers and getting a real feel for why they're leaving, what they need. And I thought it would be interesting to just share the top trends and then also include some tips and some bright spots of folks who are doing things a little differently and who are gaining some traction when it comes to addressing employee engagement and also employee retention. So first trend, and healthcare workers want to be valued. And what I mean by that is certainly pay is a part of it. And you can certainly retain your employees by paying them a fair wage or recognizing their individual contributions. But there's been tons of survey and data in healthcare around pay right now is not enough. What's the most important right now is what we call the soft benefits or the non-traditional benefits, or the ones that break the status quo. If you look at Becker's or McKinsey or Gartner, the healthcare systems or organizations that are really gaining traction right now are the ones that are speaking to employees need to have more flexibility. And typically that's around when and how they can work. So scheduling flexibility, it might be some unique approaches to PTO. Certainly training and advancement is a big issue, and then individual recognition. The organizations that are taking a unique approach to this, one really hot trend right now is PVO. It's paid volunteer time that the organization gives recognition to each individual employee's organizations that they want to volunteer for, and they pay them for that time. Flexible scheduling, not every organization, particularly in clinical workers, can give a frontline healthcare workers, especially if they're working with patients, flexibility, but they can offer to share schedules with other folks. They can offer choice of schedule to high performers. And in terms of training and advancement, a lot of organizations will give employees a chance to move within the footprint of a particular practice or healthcare system rather than losing them altogether to a competitor. So that's another way that they're providing kind of that career advancement path when in the past they were unwilling to do so. Next trend is every healthcare worker wants to be heard. And what I mean by that is they want to have active input into how they get their work done and their day-to-day quality of care, their day-to-day balance of home and work. And gone are the days of the once a year performance review or the once a week staff meeting because we have a crisis and we're concerned about patient care. Today's healthcare worker wants feedback. They want to offer real input to their colleagues, their peers. They want frequent feedback from their manager. And they really want to be able to do that so that they can make changes to their day-to-day work and make improvements, because they're on the front lines. They're dealing with patients. They know what patients need. They know what they need to do their work more efficiently and more meaningfully. And at the end of the day, they want organizations to show meaningful progress. So the worst thing you can do with any kind of feedback system, whether it's regardless of how frequent or infrequent it is soliciting someone's feedback and then not doing something with it, not allowing them the free agency to make improvements in the organization that they know better than anyone else. Another trend is healthcare workers want to be supported. On a daily basis, I hear from healthcare workers that they feel as if their organization has left them. And what I mean by that is that they don't feel like they have the tools, the processes in place to do their work efficiently and to just do their best work. And in fact, a lot of them feel as if the organization puts up roadblocks and barriers to actually having them do any kind of good work. I would also say that the motto of people don't leave organizations, they leave managers. It's still true, but managers get a bad rap because a lot of times they don't have the tools that they need in order to prioritize the workflow for the healthcare worker, the frontline worker, and they don't have the tools that they need to have those frequent conversations with their team to collaborate and to come up with solutions for better workflow, better patient care, more efficiency, more face time with patients. So obviously the organizations that are choosing automated workflows that are reducing some of the manual tasks and frictions that every healthcare worker, whether you're a clinician or administrative, hates. Organizations that are choosing those are definitely winning. One of the hot trends in healthcare and across all industries is the notion that organizations want to, employees want to be well. And there are wellness metrics that just came out from Indeed and Glassdoor, and they measure things like happiness, satisfaction, and two key metrics in healthcare: stress and purpose. One thing you hear all the time from healthcare workers is the reason I get into the profession is no longer there. My work doesn't have meaning. And part of the reason is they don't have face time with patients, and they have to spend time, they resent having to spend time on low value things instead of either helping with the patient journey or actually face time with patients. So just a few things, and I will hand it over to Andres Hurtado, and he's going to talk more about healthcare staff centered workflow and how that connects to patient-centered workflow and patient experience. Andres.
Yeah, thank you so much, Amy. I think it's really great that you pointed out, some of the onboarding and enablement challenges that we're seeing right now in the healthcare space. Primarily from a staffing and recruiting, seeing those challenges, and also training and retention challenges, right? When we talk about challenges, right, we're seeing that advocates and these knowledge workers, they're utilizing 5 to 7 different enterprise applications on a day-to-day basis, right? They're still learning the workflow and understanding what their role is within the healthcare environment. And so what we're seeing is that, there's so many different solutions and so many applications that these advocates have to learn and use on the fly while they're training and, answering the phones and answering, questions that they've never heard of, or, they're getting this first road experience on. And so where we see SpinSci fitting in and what we do and how we look at, our vision and strategy is being able to provide a one throat to choke model and taking all of these different applications under one umbrella on a shared architecture. But what I want to focus on today is more of empowering these advocates and those advocates that are out there on the front lines, right? But empowering is saying one thing. I think understanding the workflows and the challenges that they see, right, on a day-to-day basis is really going to help, you know, those advocates be empowered by creating that, you know, that one solution, that one-stop shop for these advocates. If you go ahead and go to the next slide, Amy, kind of cover what I mean by that, right? If you just go back, yeah, there. So, you know, this is our solution portfolio and how we, you know, what we bring to the workforce in terms of empowering those advocates, right? They're answering the phones, they're having to manually dial out to patients. I think when we talk about empowering, again, it's being able to have that information and that knowledge about the patients beforehand and understanding where the patient is in their journey. So when we talk about the digital front door, that system of engagement for your patients, right? It's being able to take those common access center routines and pushing that through, you know, a virtual bot that's able to take those calls for simple scheduling, right? Billing for prescription refills, you know, taking that workload off of those advocates and having your patients be empowered to take you know, those actions through a virtual bot, right, that can work 24/7, 365, is going to give more time to those advocates to understand their workflow and to adapt to their environment. From a high touch escalation perspective, right, your advocates, when a patient reaches an advocate, right, we want to go ahead and empower them by pushing data from the EHR, again, understanding where the patient is in their journey and providing them, you know, scheduling trends, billing trends, referral trends, their medical history as well. But when we look at the high touch escalation and live assist, right, it's being able to automate those routine workflow steps and focusing on cutting down, you know, average handle time, click to burn fatigue. Again, being able to do everything sort of on a single pane of glass. And when we talk about an outbound strategy, right, it's being proactive and sending out notifications, but how are we doing that, right? And I think, you know, earlier this year, we were at the NAHAM conference and we were speaking to health systems, right? One thing that we heard and one of the challenges that we understood from being at that conference was orders and referrals. You know, having advocates manually take down a list, having to manually dial out to a patient. And, you know, we're seeing about 5 to 10% of these patients answering their phone, right? Well, if we can automate that process and push that list through SpinSci and use their current CPAS and their CCAS provider to reach a patient, and when we reach a patient, be able to connect them to a live agent, right? Automating that outbound notification process and those campaigns. Again, it's really being able and helping those advocates adapt to their environment with all the different technology that they're using. If you go to the next slide, Amy, just kind of put everything in perspective of how SpinSci works and, you know, and how we bring all these solutions together. So, you know, SpinSci, I'd like to look at SpinSci as more of a system of orchestration, right? You have your EHR on the bottom right-hand side, you know, being that electronic health record for your patients, that single source of truth. Also, what we're seeing with the CRM is being more of a system of interaction, right? Documenting all of those touch points with your patients. And where you can see the solutions come into play is where, you know, with Patient Engage, that self-service for your patients, whether they're interacting through a voice channel or whether they're interacting through a chatbot, right? What's most important here and just high level is just being able to push that data and feed that through SpinSci and updating the EHR in real time. Again, just taking off and eliminating the manual processes for those advocates. And again, you could see how this correlates to the system of engagement and the system of contact for your contact centers. But what I want to go ahead and end off here with, Amy, if you go to the next slide, is, you know, showing all of the EHRs that we've partnered with, right? Being able to communicate and help communicate all of these different solutions from a contact center perspective, from a CPaaS perspective, with all of these different EHRs. So we understand the workflows, we understand the rules, and we're just that communication layer to help communicate all these different applications together. Again, just eliminating that manual process for a lot of the advocates that we see right now in the healthcare space. But let me go ahead and pass this off to Corbin, where he'll talk a little bit more about AI and what he sees.
Perfect. I appreciate that, Andres. Yeah, so, you know, within the healthcare space and, you know, in the world today, you know, what we're noticing is that, you know, there are a lot of movement to the AI and, you know, but how do you leverage that AI within your existing system today, I think is a really tough problem to solve. And that's really where IntelliPeer has kind of come in. And you know, what we're focused on is a communication automation platform. And what we've done is we've partnered up with, you know, the likes of SpinSci and a few others like SpinSci, utilizing RPA to allow us to, you know, leverage all of that digital information and patient information and really communicate that out in an effective way. So what we try to pride ourselves on is, you know, rapid deployment in the communication solution, lowering the IT burden, which, you know, is definitely a huge, you know, factor. That total cost of ownership and economic impact, and lowering that economic impact is definitely a focus for anybody in, you know, the medical space today, and that's what we've seen over time. But it's really, how do you get to, you know, lowering the effort in a complex solution, right? And that's where we've come in and we co-create options and we bring in other providers like the SpinSci of the world and really kind of focus and funnel all of that information out to your patients. And we can sit over your existing solution at this time. We call it OTT, or over the top solution. So we are the communication layer on top of your existing solution today, whether that's MS Teams, whether that is, you know, an on-prem system, but we leverage powerful AI and analytic tools from the likes of, you know, ChatGPT, which is the big one out there today, Google Lex, or Amazon Lex, IBM Watson, and as well as Google, you know, but we try to integrate all of this information and really kind of hone in and make a simple solution that allows your patients to interact with your knowledge worker and give that knowledge worker the power that they need to really push, you know, their agenda, be more efficient, and then of course, you know, create a higher ROI within your, you know, your business, you know, departments. So if we can move on. Yeah, so, you know, why automation, right? As I just mentioned, you know, it's streamlining staff tasks that Andres had mentioned as well, and really just trying to avoid attrition, training, you know, trying to, you know, lower that cost of, you know, the overhead that you guys might see in your university or in your medical facilities, and really just trying to make it easy for your knowledge workers to be able to do their job and do it efficiently, but allow that communication to enhance the customer or the patient interaction. So, you know, as you're going through this journey and your patient journeys, you know, we're empowering the patients and the staff to allow you to reduce operational costs, improve the patient experience, and of course, lower that you know, total cost of ownership or total economic impact. So we can move forward. So how do we do this, right? So this is the key to, this is kind of the bread and butter of what we do, is we sit over the top of the communication, what you have today, what is existing, so you can move into the AI and the new world of where we're going as far as just the world in general in the medical arena. And it allows you to leverage all of the things you're doing today and existing things to enhance all of the customer experience, whether that's sales, marketing, customer service, or patient services, enterprise back offices, and of course your enterprise employees. It's really just trying to hone in on what that communication looks like and really drive the efficiencies within your business and into those the medical offices. Sorry, I just lost track. There you go. Yeah, so as far as the communication automation platform, we have 3 pillars, right? And this is where we really want to support. Cut cost, cut additional cost, improve your productivity, and then also improve your patient and staff experience. Really trying to reduce your attrition, trying to increase your ROI, reduce your total economic impact, and just have a really seamless patient journey throughout your entire business. So that's about it for me. I appreciate Amy. I'm going to pass it off to Richard, and I will let him take it away.
Thanks, Corbin. Appreciate it. Hey, good morning, everybody. I'm Richard Schumann with Level AI. So Level AI, we are, this is the topic of the day, right? Everybody's talking about artificial intelligence and how it plays a role in our business environments and across the board. And so I'm going to talk a little bit about how we do it, what makes us unique to this industry. You'll see up there that we have a tagline saying contact centers in the age of AI. Level AI has been around for about 6 years now, and we really got our footing within the contact center environment. But as we've grown over the last 6 years and our customer base has evolved across the board to so many different verticals, what we're really seeing now is we've become really a customer intelligence platform and an employee support platform. So what we're really seeing more and more is utilizing AI, and AI comes in all sorts of different styles and forms. And AI can really be a true ally in helping patients and healthcare advocates have an overall wonderful experience. We can integrate across the top of any platforms, softwares as a service, you name it. We've been growing rapidly. Go ahead and let's click to the next slide, if we could. Thanks. So our mission at the core is really to enhance the customer or patient experience within any organization's environment. Like I mentioned before, we utilize true state-of-the-art AI. What I mean by that is there's a lot of organizations out there that utilize forms of artificial intelligence that still require a lot of human interaction to get to the end result that you're looking for. What we do at Level is we use a modeling system that trains AI on the intent of human conversation. So what we're doing is we're actually helping the AI understand and learn how to interpret human conversation so that it can both, in its best form, coach and provide assistance to the human. It's not about replacing the human at the support level, but it's really about helping them do their job better and helping the customer or the patient have a true enhanced experience when they engage. So we focus in a lot on the assistance of the employee, business intelligence, metadata that we can extract from an organization to really show them areas that they can improve in and drive profitability and expectations across an organization. Let's go ahead and go to the next slide. So what we're noticing across the board with our customers who are located throughout North America and the globe are some of the statistics you're going to see here. So we're seeing dramatic improvements in the amount of time it takes to onboard a new employee utilizing our AI platform. We're also seeing a reduction in churn from employees that get a chance to interact with our Level AI platform. And the reason for that is our platform is utilized for both post-call where we can analyze and review what happened in an interaction between a patient and the healthcare advocate. We can monitor these activities across voice channels, email, SMS messaging channels, all of it. And then we can also do this in real time. So we can actually train the AI model to listen into conversations in real time and provide real-time coaching assistance to those individuals as topics come across the conversation. And what we can do there is we can also provide redaction capability, which we do for a lot of our organizations who have sensitive, like HIPAA compliant information. And we can do this in recording, transcription, as well as screen recording. So we've also seen a tremendous improvement in the feedback coming from the customer base or the patient base into how their overall experience was in working with the individual they're speaking to. And then we can actually fully automate reviews. So we can have the AI step in and review 100% of every interaction that goes on, and they can score it and grade it and even provide insights into where positive things occurred and negative things occurred for coaching and analytic purposes. And then finally, another piece, everybody's talking about ChatGPT. That's a very popular topic lately, and it's a wonderful tool. I admit I use it quite frequently. I love it. The challenge with something like ChatGPT, when you move it into a business environment or a healthcare environment, is it's dependent on information that it gets broadly from the internet. Now that information gets scaled down and compacted into a very tight form for quick responses to your questions that you query within a ChatGPT. But for each business environment, it can become very challenging. So we've actually developed a product called Agent GPT, where you can literally ask complex questions of it, and within 2 seconds, it'll come back and provide detailed guidelines of how to answer questions and steps for solving problems that are based strictly on outcomes within your own business environment. And it's self-learning and it evolves as time goes forward. So it's an incredibly effective tool. And what we've done is we've now married that with our real-time tool that listens into conversations. So it's ahead of time going to recognize those specific conversations and start to feed information automatically to the individual that's serving that patient need. So now if you get a complex question related to a specific drug type or a specific outcome, it can recognize that and provide guidance on how to work with that individual. It's an incredibly effective tool. And what we're doing here is we're really starting to enhance the true voice of the patient. What's going on? How can we improve? How can we better service the needs of those individuals? And not only solve the problem, but create a bonded relationship with that individual ongoing. And of course, we're fully HIPAA compliant and standard to all needs. Let's go ahead and move on to the next slide. So I'm going to give an example of an existing customer we have today. Now, this is a healthcare insurance provider, so a little bit different. I was really trying to get one of our largest healthcare providers in here, but we're still working through the legals of sharing our names across both of our entities. But I can say it's one of the world's largest children's hospitals, and I'll just leave it at that. Anyway, but with Empyrean, one of their big issues, and this is a California-based healthcare insurance company, was they needed help with HIPAA compliance issues. They needed help training their employees on how to quickly onboard. So they had a very high turnover, a high level of burning through employees who were just struggling with their ability to solve problems on the fly. And so we've done two things with them. We've addressed the need for onboarding. We've reduced that time by about 50%, where it was taking them 8 weeks to fully onboard. We've gotten it down to 3 to 4 weeks. And we've also been able to dive into deep analytics for coaching and training purposes on the back end to help them handle complex issues. And then, of course, we adhere to their HIPAA compliance as well, and we can do redaction for them and screen recording, so that they can see what's going on within their organization and communication with their employees and their customers. We've also provided them that agent assist tool. So that's that real-time tool that listens in and guides them in real time. But some of the deep things came in the analytics piece on the back end when we're able to tag conversations and look at conversation and look at trend lines for things that are occurring. So for example, if you started to see a lot of calls coming in that were related to issues pertaining to a particular drug or a reaction, we can track those and show you the data behind it and how many times it's occurring and how you could possibly respond better to it. These are just some of the things that we can do on a proactive basis in really assisting employees and customer or patient-facing individuals to make their jobs easier, better, and more efficient across a single platform. So I'll take a pause there and see if I think I'm doing good time-wise, Kevin. I can pass it off to you unless you have a question. And
I do not. Let me wrap this up by first saying thank you to all 4 of the expert presenters and their companies and their team behind them that came together for this, I think, informative webinar. Oftentimes a company could be talking to one of them and not the others, or all of them, but in different groups and in different meetings and in different conversations. This approach that we're advocating for on behalf of the employees and the patients in healthcare is no more silos in an organization. Everybody needs to come together, all the stakeholders, and have this conversation holistically rather than piece by piece. One of the things that occurs when you do it piece by piece is these changes are very important to the future of the provider's practice. So competing priorities can get in the way with that, versus the holistic approach becomes the priority. Okay, think about that differently. Different priorities, different things, trying to allocate resources, funds, all those things. Make it one big holistic priority, and I can promise you, you can get to where you want to go. One of the things that we did not bring up that I want to go back to with IntelliPeer is that a lot of healthcare providers have on-premise phone systems, and that is the way they've traditionally interacted with patients. I can tell you that with that integration and that automation, they can actually take voice streams from your current phone system and then feed it into all of these other capabilities, the integration from a spin side, all of their omni-channel interaction capabilities for that patient discussion. And they can then integrate that into what Level AI does, so that they can give you that true intelligence around internal conversations and also patient conversations. So to recap, must-haves: user acceptance. Like Amy said, they want to be heard. They want to participate. If you're not doing that, you're missing the boat. And then you get into integration of all the applications. All of these folks have touched upon integration, but as Andre said, you can unify all of those many different APIs and all those different applications used throughout the worker's journey each day serving the patients. You can automate all of the communications channels, including, you don't have to wait until you move your phone system to the cloud to take advantage of everything we talked about today. You can bring in an IntelliPeer into the discussion. You can integrate it into Microsoft Teams. There's all kinds of cool things that you can do if you bring them to the table as a part of your team to holistically look at this. And I will say to you, you want indisputable data coming from your data intelligence and analytics for your staff experience and for your patient experience. And you're not going to get that. You're going to, if you have things piece by piece, as I mentioned before, you're going to get data that's piece by piece, and it's not going to be undisputed. It'll be disputed, I guarantee you. The key, start your conversations internally differently than you have in the past. We are here to help Kano & Associates. Any one of these vendors I can bring to the table for you. That's Kano's commitment. We spend our time in the ecosystem day in and day out with these folks and others so that we can save your time in trying to get to where you want to go. Total economic impact is a different approach, because it's not just ROI and expense driven. It's about the employee experience. Amy talked about 1.5 times somebody's salary if they leave. What about patients leaving and the economic impact of that? So these are just different discussions that traditional CFO organizations and IT organizations aren't as involved in patient experience and the operations of the care as the operations management folks are. So they all need to be at the table having these discussions and thinking differently about it. I would also say to you, if you really want to understand why patients are leaving, implement the AI capabilities that all of them have been talking about, because then you're going to know why they're leaving. You want to solve that erosion of your patient base. You look at the undisputed data that you're going to have. So Kano appreciates everybody attending this event. I'm going to open it up to Q&A via the chat if you have some time to do so. But follow Kano and Associates, because we're going to take this forward into July and August with some other providers and vendors that focus on healthcare as well. So there's more and more learnings that we're going to bring towards you. Amy, thank you. Richard, thank you. Andres, thank you. Corbin, thank you. And all of your teams and your company for being on here. So if you guys can, I'm going to stop. Well, I guess I'll leave that. There we go. I'm the person that has the big fat finger that goes 2 slides ahead. So let's look at the chat. If you have any questions, please go into the chat. I'll give you a few minutes to do so. If not, we will wrap it up and close the call. Okay, well, we do not have any questions. I will, it was recorded, as I mentioned in the beginning, and this will be available on demand. So the best way to, if you want to make sure you attend the future events or get additional information from Kano and Associates, just send a message on LinkedIn to Kevin Johnson or Amy Hood, or even to the Kano and Associates site, and we'll connect you with all of these folks. Thank you, everybody, for attending, and especially to the presenters who put a lot of time and effort into delivering this great content to you today. Thank you.
Thanks, Kano. You guys did a great job.
Thank you.
Thank you,
Thanks,
team.
guys.